Good morning, students. Today our topic is role of general duty assistant in elderly and child care. Okay, what is your role in taking care of elder people and childrens? That we will discuss. Okay, general duty assistant means that is your job role. After completion of your course, you are going to get certification as a general duty assistant. What is your role in taking care of elder and childrens? That we will discuss today. So elderly care is a fulfillment of the special needs and requirements that are unique to aged people. Okay, elderly care is also called as elder care or aged care. Okay, it is the fulfillment of the special needs and requirements. Okay, they will have some special care and requirements when they go to aged. Okay, aged people will need some special needs and care, so that requirements we have to fulfill by giving assistance for them. So before going to the topic, we have to know some age groups of human being. Okay, we have some age groups, that is from birth to 1 year. We will call them as a infant. For infant age. Okay, infant age means from birth to 1 year. The children who is having age from birth to 1 year, we will call them as a infant. Next, 1 to 3 years baby is called as a toddler. Next, 3 to 5 years children's called as a preschool child. Next, 5 to 12 years children called as a school age child or school going children. 12 to 18 years children will be called as a adolescent. Next, 18 to 45 years will be called as young adult. Over 65 years we will call them as a old adult. Next, these are the some age groups. Okay, we have to know these age groups. Next, biological aging. So we have some factors which will influence on aging. Okay, that first we will see about biological aging, how it will be affecting on aging. Okay, some people say that people age because the cells of the body changes. Okay, for old people there is a many changes. Okay, growth of the cells will be changing. So example, in women's we will be seeing menopause. Menopause means end of menstruation. So and hair turns gray. Okay, old people will be having white hair. No, that is also one biological change. Okay, next we will see psychosocial aging, how the psychosocial factors will be affecting on aging. Okay, some people believe that people age for number of things not having to do with the human body. These people believe that people age because they separate themselves from people around them. Next, no longer keep their body active means not only physical or biological factors will affect, some psychosocial factors also will be affecting on aging. Okay, that some old people will be separate themselves, they wants to live separate, so because they cannot mingle with the others, that is also one factors which will affect aging. So they, because of that, they cannot be active always, they will be thinking something and they will be looks like dull, they will not be active. Next, we will see the age related changes. What all are the age related changes we will see in older people? Okay, what all are the physical, that may be physical, psychological or biological, anything. What all are the changes we will be observing in old age people, that we will see. First one, skin, hair and nails. What all are the changes we will see in skin, hair and nails? First point, skin becomes more fragile. So we will be observing, so old people will be having skin with foldings. Okay, next, rashes are more common, they will get skin rashes. Next, skin may become pale. Okay, pale means it will be dry always. Okay, skin may become pale. Age spots, we will be observing some spots appearing on skin. Next, skin tags. Okay, skin foldings, mainly we will observe on the neck. Next, skin may become thinner, wrinkles appear. Okay, it will be thin of the skin in aged people. Okay, wrinkles appear. Okay, wrinkles means foldings, like foldings we will be observing on the skin. Next is dry skin may occur, dry of the skin, dryness. Next, hair gets gray in color. Okay, hair color change. Okay, we will observing color change of hair. Next, hair thins on the head and under the arms. Okay, we will see they will be having hair loss. Okay, it will be thin. Okay, we will be observing old age people, no, hair fall will be there. Next, nose and ear hair becomes thicker and more visible. Okay, we will be observing in old people. Okay, hair will be appearing in nose, hair, these ears. Okay, facial hair appear. Okay, they will be having hair more on the face. Okay, next, the sweat glands in the skin slow down. Okay, the sweat glands will be slow down. Okay, functioning of the sweat glands decreases. Next point, red, purple or brown spots may begin on the arms and legs. Okay, we will be observing some color spots appearing on the legs. Next, we will see about muscles and bones, how the changes we will see in muscles and bones of aged people. Okay, bones loss calcium. Okay, they will having less calcium levels, then they are going to prone more fractures because of less calcium. Okay, next, bones get weaker and thinner. Okay, because of less calcium level they are going to get weak and thin bones. So muscle tone gets less. Okay, they will not have muscle tone. Okay, properly, so it will get less. Okay, muscle mass gets lower and fat builds up. Okay, muscle mass gets lower. Okay, all the things will be lower. Okay, decreases and fat builds up. Okay, fat will be forming more in old age people. Next, we will see about respiratory system, how the changes will be seeing in respiratory system. First one, nose gets drier. Okay, always they will feel dry of the nose. Next, vocal cords lost their elastic, so the voice of the person may change. Okay, we can observe vocal cords sound. Vocal cords means while we are talking it will be these old age people, they cannot talk properly. Okay, with shivering that voice will be differ from others. Okay, we can observe that change of the voice in old age people. Next, breath sounds decreases, they will be having less breathing. Okay, next we will see about cardiovascular system, means related to heart. First point, loss of heart muscle tone, they will be having less heart muscle tone. Next, low pulse rate, they will be having low pulse rate, means heartbeat, they will be having low heartbeat. Next, less elasticity of the blood vessels, they will be having less elasticity of the blood vessels, means weakness of all blood vessels. Next, we will see about gastrointestinal system, means related to our stomach or digestive system. Okay, they will be having less digestion, less saliva. Okay, saliva. Next, less feeling of thirst, so they cannot digest some items, that's what they will be saying. So if anything they eat, it will not digest. Okay, that's what they will ignore some food which will not digest. Okay, like non-veg. Next, less feeling of thirst, they will not feel thirst means drinking fluids. Okay, they cannot feel that. Next, urinary system, kidneys gets smaller and loss of function, lower blood flow to kidneys. kidneys also will not function properly in aged people. It will decrease size and function of the kidney will be decreasing, and blood flow to the kidneys also decrease. Next, more urination. They will go urine more times. Okay, we can observe in old age people always they will go, means every they will go more urination. They cannot control their urine. Next, prostate in men gets larger. Okay, prostate gland observing only in men's, prostate gland will be present only in men's. Okay, it will be gets larger. Okay, size of the prostate will larger. Next, we will see about nervous system. What are the changes we can observe in old age people related to nervous system? First one, brain gets smaller. Okay, brain size of the brain will be decreases. Next, blood flow to brain gets lower. Okay, decreases, blood flow of the brain will be decreases. So brain weight less. Okay, means decreasing brain weight. Next, we will see about eyes, how eyes will be affected in aged people. First one, less able to focus. They cannot focus on the things. Okay, next, eyelids sag. Okay, eyelids of the aged people will be thin. Next, eyelashes thin, short and less. Okay, decreases. Okay, eyelashes also will be changing. We can observe in old age people by seeing them on. Okay, people get sighted. Okay, they will get sight. They will say that we cannot, I am not able to see that, I am not able to see this. Okay, they will say no, we will observe in our grandparents. Okay, people get sighted. Less tears, they cannot cry also. Okay, in old age people we will see that they will not get tears while crying. Next, we will see about taste and smell. So we will say that if we are giving any food, they will say that it is not tasty, because they will not having taste buds. Okay, decreasing the taste buds of the old age people. Because of that, they will say that if we give nice food also, they will say that it is not good, because that is the less function of taste buds. Okay, next we will see endocrine system. Endocrine system means related to hormonal glands. Okay, gland, related to glands and hormones. In old age people we will see less release of hormones. Okay, they will not we will observe that imbalance, hormonal imbalance. Okay, next we will see the health related changes. Okay, what all are the health related changes? We can see them. Okay, slowing down of mind, thinking ability and physical function. They cannot remember anything. If we are saying also, they will ask everything again and again, because that is one, because of slowing down of their mentality. Okay, they cannot think properly, they cannot have proper ability to give answer. Okay, next, physical function. Impaired physical function means they will not able to do any activity without assistance. Always they need one assistant to do anything, any physical activity. Next, less social support, loss of loved ones. Okay, less social support, because because some people they will not have some proper caring. Okay, in family members also they will not take care. No, that is also one uh, change in old age people. Because of that, they cannot mingle with others. Okay, they will feel lonely. Next, loss of loved ones means they may lose loved ones, means husband or wife, any friend. Okay, like that. That is also one health related change of old age people. Next, we will see thinking and emotional changes and needs. Okay, not all people have mental problem or confusion. Okay, all we cannot discuss that all aged people will have these problems, because some people will be active and they are always very active. Okay, so we will see some social changes and needs. What all are the social needs they need? okay, aged people. There are many social changes and needs for a old people. Many of these related to the fact that loved ones, both friends and spouse, others may have physical problems like sight. Okay, some people will need more care from the family members, so by that they can be happy. Okay, we have to make them to be happy by giving assistant in everything. Okay, next we will see the basic needs of elderly people. Okay, what all are the basic needs they need? Okay, here we learn about safety, security, food and fluids needs of the elderly people, what they need. Okay, which safety, okay, what security, okay, in food or fluids they need. Okay, that we have to see. Okay, first we will see some task for the elderly people. We have some task. What is that? Erickson, a psychologist, listed some major developmental tasks that every person must accomplish during life. Okay, Erickson is a famous psychologist. He said some major developmental task. Okay, while we are giving care to the elderly people, general duty assistant means here you are the general duty assistant, so we should know some task while giving care for them. Okay, according to Erickson, older adults wants to share their wisdom, maintain their sense of self, maintain integrity and be happy with what they have done. Old adults who cannot do this task may be sad, depressed, unhappy. They may think they are useless. Okay, we are observing in our family members also. Some old people always they will say their wisdoms. Okay, wisdoms what okay, their integrity. Okay, what they did in their past. They will be discussing. So we have to give chance to discuss with us. So they can, by that they can feel happy. Okay, we have to listen what they are saying. Okay, then they will be happy, otherwise they will be sad and they will feel that they are useless and they may get some psychological problems if we are not listening them. So we have to give chance for them to discuss everything. Okay, next, thinking and learning abilities. What all are the thinking and learning abilities? It affects how we communicate, instruct and teach them and their family. They need special care during communication and during exercises. They often have physical and mental problems that can interfere with learning and thinking process. Okay, all old people, so it is very, communication is very very important. So while we are communicating, talking with the old age people, we have to see their special care. Okay, we have to give some proper attention to them. Okay, we have to give with their own language, what language they are understanding, in that language we have to use and we have to talk them. Okay, they need some special care during communication and during exercises. While doing physical activity we have to assist them. Okay, so they may have, that old age people may have short attention span, means they cannot attentive. Okay, they have short attention because they are already aged people, no, they cannot pay proper attention. Next, less learning ability. They cannot, if we are saying anything to learn, they cannot learn properly because they have less learning ability. Next, less ability to understand. Okay, they cannot understand properly what we are saying. Next, inability to communicate. Okay, they cannot communicate properly with us. Next, poor hearing and sight. They will be having poor hearing, they cannot hear what we are saying. That's what they are asking again and again. Next, sight they will be having sight, means eye vision, less eye vision. Next, when general duty assistant or communicating with elderly patient should have, okay, as a general duty assistant you should give some proper attention to them. Okay, what all are the points you have to follow, that we will see. First point, give the person their eyeglasses and hearing aids of they have. So we have to provide some eyeglasses. Okay, almost all old age people will be having eyeglasses because less eye vision, they will be getting eyeglasses. We have to provide eyeglasses for them. And hearing aids means if they have any hearing problem, they cannot hear, no, that time we have to give hearing aids. By hearing aids they can, this is a mission. Okay, we have to provide for them for proper hearing. Next, speak slowly and clearly. If we want to say anything with them, we have to speak slowly and clearly so that they can understand it what we have said. Next, keep information simple. Okay, we have to say that information in simple form. Okay, then they can understand properly. Next, use that words the person can understand. So if we are using any English words or other language, they cannot understand properly, so we have to use the language which they can understand. Okay, then they will be feeling happy. Use pictures and large print materials and provide enough light and ventilation. Okay, if they are educated, for them we can use some pictures and printed material and enough light and ventilation for them. Okay, if they are educated, we can use these type of pictures and large printed materials for understanding any information. Next, allow patient to ask any doubts. Okay, patient means here old age people, so we have to give chance to ask any doubts. If they have any doubts, we can clarify. Okay, we should give some time to ask doubts. Next, room should be quiet. Okay, the patient means the old age people room should be quiet. Next, safety and security needs. What all are the safety and security needs they need? Okay, this is main basic need of human being, important. Okay, for all, what all are the basic needs of human being? Okay, old people, we have mental, sensory. Okay, sensory means eye, ear, or any physical loss or great risk to prone to get accidents. Okay, provide safe environment and food and fluids. Okay, old age people almost all have physical problems and mental, sensory, eye ear problems already we have learned. Eye vision, less eye vision, hearing problem. Okay, so for them we have to give assistant in every time. Means if they want to go in outside, means we have to give some assistant, we have to help them while going outside. Okay, otherwise they will be fall down. Okay, means they may get fractures because of less calcium. More old age people are going to get fractures. So we have to take proper care of these people. Next, provide food and fluids. Okay, more these old age people, they want to drink fluids only. Okay, so we have to provide more fluids to them. So next we will see about children. Children is also very important. For taking care of children, we have to see that in houses also we should not give any sharp items. Okay, we have to observe that there should not be any sharp items while playing. We have to see this observation must be there. Okay, sharp things, any these some accidental prone items, we should not provide them while playing. So be careful and take care of your elder people, means parents, grandparents, and children who is around with you. Everyone should understand this topic. Okay, thank you everyone.